All right, let's get my... Okay, greetings everyone, and thank you so much for joining us and sharing an hour of your very important time with us today. We are delighted at the size of this crowd. A lot of you are old friends of both APSAC or ZAP, and many of you are new friends, and we welcome especially our new friends, although we're pleased that everyone is here. This program today is part of a series that APSAC has sponsored in response to the COVID-19 epidemic. We've been doing a series of Zoom chats, some more formal than others, and we're delighted today that Victor Vieth, the Director of Education and Research at the Zero Abuse Project, has agreed to convene today's call, and you will hear more about Victor from a more formal introduction coming very shortly. But for those who don't know, APSAC is the American Professional Society on the Abuse of Children, is a multidisciplinary professional society, and our mission is to serve those of you who are out there serving the children and families involved with child maltreatment. We are particularly concerned with translating good research to support your practice, and to that end, we offer different publications and training opportunities like this one. I especially want to mention an online course that we just launched featuring 29 lectures from a variety of experts, and right now we're offering that entire course for the introductory price of $25. You can learn more on the APSAC website. APSAC, to some of you, is best known for the wonderful colloquia we offer each year, where science meets practice, meets collegiality, and a little fun. We are really pleased to announce the new dates for 2020, just confirmed yesterday, will be September 21 through 24 in New Orleans. And you can find all the information as it becomes available at our website, which is apsac.org. APSAC. For our hour together, of course, we've allotted the majority of our time to our expert speaker, but first we always start these calls with a little bit of news from a Washington update, and there's just two things I'd like to make sure I share today. The first, there is an organizational letter being sent to members of Congress that so far has got about 600 signatures, urging Congress to remember the child welfare agencies and professionals as they convene, as they work on the next care package for financial support during COVID too. As soon as I'm done talking, I will put the link to sign on to that letter in the chat box so you all can see it. And I urge you and your organizations to consider signing on to that letter, contacting your legislators to remind them not to forget the hard work and the important agencies involved with child maltreatment in the next COVID-19 response package. There's also going to be a link where you can pick up some social media that you can tweet out and encourage your colleagues to get involved with that effort as well. As far as our presentation today, again, everyone will be muted except the panelists. I will be collecting your questions from the chat bar on your screen and presenting them to Mr. Vieth at the end of his presentation. I've also collected the questions that were submitted to us via the Google form that we had available with registration. So we won't, this crowd got too big to take Q&A directly, but I'll be coordinating the Q&A when Mr. Vieth is done with his presentation. And now, without further ado, I'd like to introduce Dr. David Corwin, the president of APSAC, who will give our guest speaker the introduction he deserves. David.
Thank you very much, Janet. I want to thank Janet and the APSAC staff and the Zero Abuse Project, Victor, for his willingness to present today. This idea for this web chat was born less than a week ago. So that shows you how nimble APSAC Zero Abuse Project can be when they're trying to help the practitioners and professionals in this field. Victor had published a really useful document, which we will also have posted with the other materials and the recording of today's web chat on the APSAC website. I first met Victor a little over 20 years ago in Alexandria, Virginia, when he was executive director of the National Center on the Prosecution of Child Abuse. But Victor is really one of those of us who have served on the front lines of addressing child maltreatment. He started his career as a prosecutor in a rural community, Winona. Is that correct, Victor? Or Minnesota, where he still lives, and then became so distinguished that he was invited to become the executive director of the National Center for the Prosecution of Child Abuse. About a year and a half ago, he joined the board of directors of APSAC, and before that, he joined the board of the Academy on Violence and Abuse, became its president, and is serving as its board chair at the present time. Victor is one of the most passionate advocates for abused children that I know of. He is always informative, always captivating when he speaks. And he is also a man of faith, and his latest degree is from the Wartburg Theological Seminary on Religious Studies. So Victor has helped APSAC, ABA, address the interface between the faith community and our efforts to diminish violence against people and to prevent child abuse. So without saying any more, thank you very much, Victor, for your willingness. Also, you're one of the prime movers behind the CAST effort at universities around the United States, at more than 80 universities, medical schools, and law schools in 20 states so far. Thank you, Victor.
Great. Thank you, David. Thank you, Janet. Thank you, APSAC, for hosting this webinar. It's good to be with you this afternoon, albeit under the difficult circumstances of a pandemic. The topic at hand is, how do we as multidisciplinary professionals respond to a likely increase of child maltreatment during a pandemic? Mitch, my PowerPoint isn't advancing, if you can help me.
Yep, hold on. Okay, you're sharing your screen, correct? And then
yep.
The space bar doesn't move the PowerPoint forward?
No.
Click the arrow on the slide you have up currently, your mouse, and then it should work.
Okay.
There we go.
All right. This is how multidisciplinary teams work.
Thanks a village.
To that end, toward that goal, we'll chat just a little bit about the factors that are likely contributing to an increase of child abuse and neglect during this pandemic. We'll chat about recommendations. Dave mentioned the paper that I co-authored. There's a ton of recommendations there. We can't get to all of them in this limited time, but we will chat about 14 of them. Bree from APSAC will be tag teaming with us, and as I mentioned, a number of resources. She'll be putting it up in the chat box so that you can access it. When this is all done, the PDF of this PowerPoint will be there as well, so you'll have that as a resource. Janet mentioned we do hope to have some time for Q&A. Not quite sure how much time we'll have, because I got about 40 slides in a limited amount of time. But if we don't get to very many, if any questions, you'll have my PDF. My email is there. I'm happy to dialogue with you, as are the entire team at the Zero Abuse Project and also the entire team at APSAC. We work for you. Anything we can do to help you, we will. This is the paper the presentation is based on, and Bree will post it in the chat box if you haven't seen it already and want to download it and look at it at your leisure. Most experts in our field do believe that child abuse is increasing during the pandemic. Here's an op-ed from the New York Times from a pediatrician making that argument. And the concerns are as follows. Well, most child abusers are mom and dad or siblings or others in a family unit, and now that family unit is more confined. And since the family is the primary source of child maltreatment in the country, it is likely then that child maltreatment is increasing. We also know that victims now have less contact with mandated reporters. They're not in school every day. They're not intersecting with their coaches. They're not going to worship services at their faith tradition. They're not accessing as many outside professionals, as many mandated reporters as they may have been in the past. Online predators now know instinctively, gosh, kids are online more often. Even if you're a convicted sex offender, there's a lot of push from defense attorneys to lessen the restrictions around you. And that may create openings for online predators to access more children. That is a concern that has been voiced in the field. And just because of the pandemic, child protection services are declining, or in some instances being eliminated altogether. So what on earth do we do about this? Well, it's helpful to remember that although mandated reporters may not be having as much contact with children as they have in the past, they are still mandated reporters, and we need to convey that to them. They're still obligated by law to report a reasonable suspicion of abuse. And a number of these reporters are still having at least some contact with children. Let's focus for a moment on teachers. The United States Department of Health and Human Services says 1 out of 5 mandated reports in the United States come from a teacher. And many of these teachers are still having access to children. They are conducting virtual lessons. They are sending homework through a number of online resources. They're having some dialogue with these children. So remind these teachers that they're still mandated reporters, encourage them to have virtual sessions with the students, several students at a time, as they would in a classroom. Urge them to have the children on Zoom or another platform where you could actually see the child's face. That may help you identify telltale signs of abuse, such as a hand slap or a blackened eye or the imprint of a belt on a child's face. Also gives you some sense of the child's demeanor. It may allow you to detect yelling or screaming or other concerning things going on in the background in the child's home. I just read a survey recently where, if my memory's right, 61% of parents said in the last week alone they had yelled at their children at least 2 times. Now, even if that yelling doesn't rise to a level where a teacher would be justified in making a mandated report, it may be a clue that there's some stressors going on in the family. That teacher may reach out to the CAC or other professionals. What are some resources I can give this family to reduce the level of stress, because I had some concern about the fight I overheard in the background. And of course, in some instances, you may overhear something that does justify a mandated report. Then we need to work with our teachers and other mandated reporters still intersecting with families to use them as a catalyst to get as many resources into the hands of parents and children as possible. The World Health Organization has published a number of free, really valuable resources for parents and for children on managing their stress. Here's one on the screen, and Bree will be posting a link in the chat box. Play Nicely is an online program in both English and Spanish developed by Vanderbilt University. They've also published research on the efficacy of the model. And it's a simple online platform, a handful of videos to teach parents how to discipline their children without violence. How do you get children to play nicely and behave and manage their own stress without you as a mom or dad hitting them? That's a great resource. And now parents might be very anxious to look at something such as that. Many children's advocacy centers in the United States already have a whole host of child abuse prevention programs. Here's a screen capture from the National Children's Advocacy Center in Huntsville. What prevention programs do you have that your MDT is promoting or you've implemented at your CAC? And if you haven't already converted them to a virtual world, what can you do now to offer them virtually? Can you develop that virtual platform as simple as a Zoom presentation, such as what we're doing here today? Dave mentioned in less than a week we got this up and running, finished the PowerPoint yesterday. What can we do to move to a virtual world where we can get prevention programs into the hands of families and children? Aaron's Law is not abrogated. 37 states in the United States require schools to be educating children about personal safety in the hope of protecting them from child sexual abuse. If you are in one of these states, then by law, the school is still allowed to provide Aaron's Law education. reach out to them. Have you done that curriculum this year? Maybe they haven't. Now they're struggling because they don't know how to do it virtually. Perhaps you could offer one or more resources, or you yourself teaching a component to get that sort of information into the hands of children. And what can you do to modify it for a COVID-19 pandemic? Reminding children that they still have some resources, still have some places they can turn to if they just don't feel safe. This resource was published yesterday. I haven't had a chance to look at each of them, but what I have is really good. SHIELD is a task force of MDT professionals in the great state of West Virginia, and they developed this package, and they've tailored it to COVID-19 issues, and it's designed for school children of various ages. How do you protect yourself online and in your home and elsewhere, and what are options you have if you don't feel safe, and how do you manage your own stress? Everybody participating in this call now has the power to spread that resource tomorrow to all of your contacts, and to pass it on to teachers, who in turn can pass it on to youth and to parents. Dave mentioned I'm the current board chair of the Academy on Violence and Abuse, and the AVA has collected a wide variety of COVID-19 resources for you and your teams. Dr. Michelle Matson, who is another board member of AVA. She's also one of the foremost researchers and experts on building resiliency in youth, has been designing once per week these simple little tools that you can pass on to parents you have access to, that they in turn can download, that they can read and go through with their children to help the children manage the stress of living now in a pandemic. We have to think differently. We have to think creatively. We now have new potential stakeholders on the front lines of child protection. We have grocers accessing children and families that didn't have so much contact with them in the past. They may be delivering medicines and groceries and other resources. So work with those folks. What can you do to make them better equipped to handle cases of child abuse? You know, in 17 states, they're already mandated reporters. So you'd simply be helping them perform their function. You are the eyes and ears of the front lines of child protection now. But think creatively. What practical, simple resources could you give them so they would be better skilled at identifying and perhaps making a report of suspected maltreatment? This was a tool developed by a handful of board-certified pediatric specialists in child abuse. They designed this at the request of the Boy Scouts of America some time ago to help BSA as they educated frontline professionals what is or is not suspicious of physical abuse. A simple tool like that. What parts of the body where there's an injury at is suspicious of abuse, and why is it suspicious of abuse? Really a simple tool. Now that may be too graphic, but you could modify it. Shira Berkovitz, Bazil Trevijin wrote this great resource for churches and other faith communities on responding to instances of child maltreatment, and they took that simple BSA product and they modified it in a less graphic way, but it still has the outline of where suspicious injuries are and why blows to those parts of the body may result in an injury that could be seen by somebody. Children's Mercy Hospital in Kansas City has a free child protection app called literally the Child Protector app, and they have two versions. They designed one for medical professionals and a second for MDT first responders like law enforcement officers. Get those into the hands of your patrol officers and others who may be intersecting more with families as they patrol neighborhoods to enforce quarantines and the like. So they have a simple resource to recognize something that might be suspicious. And consider these apps and how you might modify them for grocers and other folks who are now frontline professionals. Now, of course, there's a concern. You don't want a grocer to think that he or she is a child abuse investigator. But generally speaking, the research on mandated reporters say that ignorance is a big driving factor why many people won't report. So anything we can do to lift that veil of ignorance, we're going to have a better chance of a report coming in. What can we do creatively? Our multidisciplinary teams or case review meetings need to continue to take place. We're not meeting in person anymore. We're doing it virtually via Zoom and other platforms, but we need to continue those meetings. And perhaps the next meeting should center around this. let's look at all the kids in CPS or on our juvenile probation list that we're having ongoing involvement with, and which of those kids are at highest risk of being abused in their current facility or in their home, whatever factors you may use in making that judgment. Once you've identified that list, divvy up the tasks. Who's going to be following up to make sure each of these children is being accessed on a regular basis? Is it the CPS child protection worker? Is it the juvenile probation officer? Is it a school resource officer? Is it a community member that you're intersecting with, such as a teacher or a faith leader? But who is going to be intersecting with that child as an outlet in case things are not safe and to help the child manage his or her stress? Those of you who are prosecutors, you need to work with your courts, educate those judges. Hey, we can't be delaying any sort of hearings involving these youth. We need to be intersecting with them to see how we can help them. We may have a youth in a residential facility who suddenly has been denied significant resources, such as mental health. Well, if the court learns about that, we can order that those resources continue. We need to make sure that that sort of contact is continuing. If you're a prosecutor, a victim advocate in a prosecutor's office, you got a child abuse trial 5-6 months down the road. And so normally you think, I don't have to really start court preparation now. Well, maybe because we're in a pandemic, you do want to expedite that. You do want to be reaching out to that child, having a Zoom meeting with him or her, and just seeing how things are going on in their life. They may have some fears. You know, everything else is changing during the pandemic. Everything now is virtual. They see mom and dad having virtual meetings. They're on Zoom to talk to grandmas and grandpas and the like. And they've got anxiety. Is that how the trial is going to be? So you can hear from them if they have those sorts of concerns. There could also be nefarious things going on. That family has never really liked this child making the outcry against grandpa, and now the child is isolated and nobody's having contact with the boy or girl at school and the like, and so now extra pressures are being placed on the child to recant. Or the child sees, gosh, you know, dad, who's the offender, is out of the home and mom has lost her job and we're not sure how the mortgage is going to be covered. Maybe I really do need to take it back. We can ward off some of those concerns by expediting our court preparation for some of these victims. For the CPS workers, we're going to have to adjust our case and safety plans during this pandemic. We need to continue mental health services. We may have to be creative. We may have to implement telemental health, even if we haven't done that in the past. Those of you who are connected to Children's Advocacy Center, Calio is a great resource from the NCAC in Huntsville, and they recently said, hey, here's a good summary from Calio and all the peer-reviewed research on telemental health. Generally, that research says it's a good idea in a number of cases, but you do need to have some training to pull it off successfully, and you do need to be aware that there are weaknesses. Confidentiality may be compromised. Somebody in the child's home may have the ability to overhear what's going on, for example. There are insurance issues. Will the insurance provider for a family actually cover telemental health? What if a sensitive subject is being broached with the child and they break down? The beauty of being in the same room with the child is you can help them be that physical presence to manage what is going on in terms of their emotions. But now you don't have that physical presence. You also have to have a backup plan. What if the online communication, there's a break in it? What's your backup? Do you also have the child's cell phone number? Is there another way to access the child? Do you have a patrol officer nearby who can come in and check on a child if they seem to be very emotional, maybe throwing out a suicidal thought and the communication line is broken? What is your second and third backup plan if things go awry during the tele-mental health session? What adjustments do we make to our safety plans for the children we're intersecting with in the child protection system? You often have a safety plan for the child. Hey, what do you do if you're uncomfortable on a visitation with dad, or as you're living with mom? What are your options? We need to adjust that now to this pandemic era. Could be as simple as saying our new safety plan is the child cannot have his or her cell phone taken away from them. Whatever it may be, depending on the family you're working with, but there needs to be an adjustment in that particular regard. If you had determined before the pandemic there needs to be regular safety checks, that should not be eliminated during the pandemic, because now, if experts are right, there's probably a greater risk of child maltreatment. So perhaps it's even more important for those safety checks to continue. So your team's going to have to think about, how do we continue this critical resource? It may be that a social worker or law enforcement officer, somebody still going in a home periodically to do a safety check, but hopefully they're equipped with personal protective equipment. Hopefully we've got some social distancing rules when you come into the house. If that's not an option, maybe have mom or dad walk around the house with a computer so you can see that there's food in the house and other things that you'd be normally checking on. You've got some hope that that's actually being done. You could perhaps accompany that with a drive-by of the house. There may be families where more than one professional is going into the home. You may have somebody in the home with a disability who's aging, and they've got personal care attendants who may still be coming in to the house to assist them. You may have an offender in the home where a law enforcement officer is periodically checking on his or her status. If you do have multiple agencies, multiple professionals going into the home, maybe we can tag team. Maybe we can say, hey, officer, could you also do our safety check? We'll walk you through what we need your assistance on. Maybe we can think creatively along those particular lines. We absolutely have to be concerned with the risk of this virus and the possibility of even death. But we have to balance the concerns about the virus with the concerns that a child may continue to be maltreated. So, develop a good checklist that you feel comfortable with. Here's some questions on both sides of that equation. If we're assessing the risk of COVID-19, has anybody in the home we're considering entering been diagnosed? Have they been tested? Do they have any symptoms of COVID-19? Have they checked their temperature today? Has anyone in the neighborhood or the school or the workplace this family's been intersecting with, have they been diagnosed for COVID-19? Has the family been following CDC guidelines on social distancing? And what confidence do you have if they say that they have, that they're telling you the truth? Is anyone in the home at high risk if they contracted coronavirus? Do we have an elderly person? Do we have somebody in the home with immunity issues? If you do go into the home, do you have personal protective equipment available to the team? And is it the sort of equipment that you need for this particular environment? Can social distancing even be practiced in a home? You may have a large family in a very small apartment, and try as you might, you couldn't practice social distancing. Those are legitimate questions. But on the other side of the equation, you also have to assess the risk for ongoing maltreatment. So I took a few things from the Minnesota Department of Health and Human Services. They had a long checklist as you assess risk of abuse, but here's a few things I pulled out. Do you have any indication the caregiver's current behavior is violent or out of control? Is the caregiver describing the child in particularly negative terms? Is the caregiver in the past caused serious physical harms? And what were the triggers of that harm? Maybe those very triggers are once again in place because someone's lost a job, for example. Is the family refusing access to the child? So you call to have a virtual safety check and you say, I want to see the child, and the mom or dad just refuses. Well, that's a telltale sign that somebody needs to get into the home. Is the caregiver unwilling or unable to meet the child's basic needs? They've lost their job. They're really struggling. They're low functioning. They really just don't have enough food in the house. What do you need to do in that emergency? And has the child expressed to any member of the team or any mandated reporter or any professional or any person at all that they're really afraid right now of their caregiver? That would indicate we need to make sure somehow, some way, we're doing a check in that home. The National Children's Alliance has done a great job compiling resources for forensic interviewers and CACs. Here's a screen capture. They're continually updating this resource. The paper that this presentation is based on, you see that they posted it there in that column. They also have some webinars with CAC leaders. I saw one with Jean Klein from the CAC in Omaha, Nebraska, about how they've adjusted to COVID-19 in this new world. So there's a lot of resources there for CACs to take a look at. We're going to have to consider how we do forensic interviews going forward. Child makes an outcry to their teacher that dad has touched them sexually. We're going to have to still do a forensic interview. That child is having ongoing access with that alleged offender. What are we going to do? Well, it may need to be an in-person interview. And if so, what is our safety plan for that interview? Do we have masks for the child and the interviewer? This is Allison Foster, a CAC interviewer in Columbia, South Carolina. She posted this picture of herself on Facebook recently and said, this is the new normal when I'm doing in-person forensic interviews. Both myself and the child, we have a protective mask on. Children are being screened at a lot of CACs, simple screening as you might go through if you go to a hospital or a clinic these days. My wife went to a clinic yesterday with my brother as a broken leg, and they went through simple screening to see if you have any symptoms indicative of coronavirus. Do you have a headache? Do you have a fever? Do you have a cough? Simple things like that. Take their temperature. Simple little screenings as you might do at a healthcare facility. Doesn't eliminate the risk, but perhaps lowers it. Can we have some social distancing in the forensic interview room? We may want to, in the forensic interview, spend a few extra minutes on rapport, helping the child adjust to this new pandemic world, to the idea that everybody's wearing a mask. The child may not be freaking out about any of that. They perhaps have already seen people in the neighborhood or the grocery store wearing masks and the like. It's just the new normal. Can we, we must clean the forensic interview room before and after the forensic interview, as well as any interviewing tools such as markers or paper or anatomical diagrams or dials that may be employed during the forensic interview. Even if the child has to come for the in-person interview, because you can't do it all or can't do it safely in the child's home, that doesn't necessarily mean that all the MDT members have to come to the Children's Advocacy Center. Do you have the technological ability for the prosecutor and the investigator and the social worker to connect to the interview remotely and still have an MDT staffing after the forensic interview? If not, that certainly is something to work for in the future. If we have the capabilities, and if it's a safe option, we could also explore teleforensic interviewing. But there's some factors you gotta ask yourself. What is the age of the child? A 4-year-old may struggle with a virtual forensic interview to a much greater extent than, say, a 14-year-old who's more sophisticated with technology. How, if you do a teleforensic interview, are you going to avoid suggestive practices? How are you going to make sure that nobody is scripting the child or in the other room somehow conveying messages to the child as to how they should or shouldn't answer the question? Or that they're overhearing the interview to make sure the child is saying what they desire. Things that may be raised by a defense attorney if the case ever comes to trial. We have to think about that in advance. Got to get your prosecutor involved in this conversation. Most of you are in states where Idaho versus Wright applies. That's a U.S. Supreme Court decision saying, you know, these forensic interviews, they can come into evidence under the catch-all or residual exception to the hearsay rule, but they have to meet certain indicia of reliability. Well, how are you going to make sure that this teleforensic interview meets those legal standards? Because if it doesn't meet those legal standards, no matter how good a job you did, no matter how powerful a child's statement, you may not be able to get it into evidence. And this will be a case of first impression for many courts. So we have to think about in advance, what's the argument we're going to make to a judge later on that this has all the same standards in place as a forensic interview inside the CAC. The more thought we do early on, the better off we're going to be at the back end of these cases. we need to remind everybody on the team about polyvictimization. Polyvictimization research tells us that 2/3 of maltreated children are violated in at least 2 ways, and about 1/3 are violated in 5 or more ways. And if child abuse is increasing during the pandemic, we won't perhaps know how high the increase is until a really hard research somewhere down the road. But if it is increasing, then even more than in normal times, we may have maltreated children who are violated in multiple ways. In our Child First forensic interview training program that's used in about half of the country, there is a polyvictimization screen built into the interview. So if the presenting problem is sexual abuse, during the course of the interview, you still screen for the possibilities of physical abuse and emotional abuse and neglect and witnessing violence and so on and so forth. If you don't have a polyvictimization screen built into your forensic interview, now's the time to consider doing that, and to alert the entire MDT to be alert for multiple possibilities of abuse anytime you see one form of maltreatment. We can work with our churches, our synagogues, our sporting programs, and the like, other youth-serving organizations that may still be having ongoing contact with their youth. I know of coaches, for example, okay, the baseball season can't get underway, but they're still dialoguing with their players about how do you keep in shape, and here's some things you can do, so on and so forth. So work with all of those youth-serving organizations and say, okay, what child protection policies do you have in place during normal times, and how do we adjust those for this pandemic era? If you're not familiar with Sacred Spaces, it is a organization based in Pittsburgh that works to address abuse in the Jewish community. And they have this amazing program called Aleinu, which is already an online platform where they work with synagogues to meet certain standards in terms of child protection. They are now working with the synagogues to adjust those policies for a pandemic era. Well, what might that look like? Let's just take one simple idea. Well, in a normal era, we would want to limit the one-on-one contact between an adult and a child. And so you'd have two-deep leadership on a youth outing through the school, for example. You'd have people periodically checking in a classroom, simple things like that. Well, how do you take those principles and adjust them in a pandemic era? Well, it could be a school or another youth organization say, okay, this is the school Zoom platform, and only this platform you use when you teach virtually. And I, as a principal, may, just as I could in the classroom, periodically jump in or out. I'm requiring you to record your classroom sessions so that I can periodically look at them, A, to make sure you're teaching well and see how the children are adjusting, but it's also a safety check. You could say to teachers, hey, here's some simple rules to remember. If you need to do a virtual session with one or more children, you're going to be dressed appropriately. You're not in your pajamas. It would never be conducted from your bathroom or your bedroom. Simple things like that to adjust to this pandemic era. We mentioned at the outset the concern that a number of investigators have that online crimes are increasing. I just spoke this morning with some prosecutors who are seeing an uptick in cyber tip line reports. All right, well, how do we adjust? Can we increase the amount of education we're giving youth and parents about the dangers of an online world, and that those dangers may be increasing during the pandemic? Prosecutors, you got to resist efforts from defense attorneys and parents advocates to delay processing of cyber tip line reports, examination of child sexual exploitation images. Even people on our side are saying we just can't keep up to this standard in a pandemic era. We got to push back on that, and really push back hard on defense attorneys filing motions saying, oh, we need to relax the standards. My client needs to continue his job, but he can only do that if he can go online and participate in a virtual world. Well, if it was too dangerous to have him online before the pandemic, it's even more dangerous now, arguably. It doesn't mean we can't meet those needs. In our paper, we have some suggestions of the footnotes about alternatives to meet the needs of these offenders during the pandemic without relaxing standards to a level where we're increasing the risk. Now might be a time, if you have the resources, investigators, to be very proactive in your online investigations. You could easily now create a profile of a adolescent who's upset about all the yelling and the drinking in the house and just wondering how the heck they could get out of here. You could develop some really realistic profiles now that might help you catch one or more men or others that are online looking for children for sexual purposes. MDTs, talk to your journalists, the contacts you have in the media. Make sure they're doing stories about the perhaps increase in child maltreatment, but really get them to focus on, here's some practical tips for you to be the eyes and ears of protecting children out there. And in terms of online crimes, if you are stepping up your investigations, make sure the media covers that. Why? Well, the idea would be just as on, say, Memorial Day weekend, you see all these extra ads that the State Patrol is really stepping up the number of troopers on the road, and they do that as a deterrent. Oh, I'm going to get caught, so I'm not going to drink and drive. Well, maybe if we're educating folks through the media that we're going to be more aggressive in looking for online predators because of the dangers of the pandemic, that may serve as a deterrent to some offenders. If you're in a state with a lot of rural communities, we're going to have to think creatively. If you've got one or more services where you've got to transport a child an hour or two to the local CAC or hospital or the like, you perhaps can't do that anymore. It'd be too risky to take the child in the confined setting of the car and transport them. It may even be illegal to transport them that far if you've got stay-at-home orders. So what else can you do creatively? Some states, such as New York, in the past have served their rural communities with a mobile children's advocacy center, some of which have been accredited. That may be a resource where you bring the CAC to the child. Now, you're going to have to make sure the vehicle is as safe as possible. It may be harder to do social distancing in a mobile unit, but that risk may be less than actually transporting the child some distance. So think creatively in those terms. You've got somebody who wants to have ongoing remote contact, their perpetrator removed from a child's home, where you can't transport them now an hour or allow them to drive an hour to see the child. Maybe you've got some facility where they can come there to, say, a visitation center and still have some contact, albeit remotely. Let's think creatively about addressing the needs of our rural communities. This is a subject that even in normal times gets too little attention. Dave mentioned that I went to seminary and graduated in 2017. I specifically worked with a seminary to focus as much of my training as I could on the issue of the intersection between religion and child abuse and the spiritual impact of trauma. This was an American Psychological Association literature review published in 2009, and at that time, there were 34 major studies on 19,000 maltreated children. And most of these studies found that most kids who endure trauma, who are abused or neglected, it does impact them spiritually. This was a study published in 2017 in Child Abuse and Neglect. It was a qualitative study where they interviewed a number of forensic interviewers across the country, but they documented how often in forensic interviews or MDT assessments, children are raising spiritual questions. Am I still a virgin in God's eyes? I prayed and I prayed and I prayed and I asked God to stop the abuse, but the abuse continued. So what does that say about me or God or both? And if we don't address these issues, it impairs the ability of the child to cope physically and emotionally. So the researchers said, we got to build stronger ties between our CACs, our MDTs, and the faith communities. We have to develop case plans where, when it's appropriate, it's not appropriate for every child, but where it's appropriate for a particular child, because they're raising spiritual questions or indicating they want a spiritual resource, that we can coordinate medical, mental health, and spiritual care together. The recommendations I just made are entirely consistent with the cultural competency standards to be an accredited CAC in the United States, where we have to take into account the child's religious or other cultural characteristics. This is Shauna Galloway Williams, the Executive Director of the Children's Advocacy Center in South Carolina. She became adept at the research on spiritual injuries, realized it was a big issue, that it was coming up a lot in her CAC from abused children. And the pastor on the screen is Carrie Nettles, who used to be a pediatric chaplain at a hospital, so already had some skills working with kids who have experienced trauma. She went through a program we called Keeping Faith, which was rigorously designed to prepare folks to be a chaplain or otherwise work to address the spiritual needs of children and coordinate that with your CAC. She went through that training. She connected with Shauna. She became, I think, the nation's first Children's Advocacy Center chaplain. And every year, about 500 children or families ask for the spiritual resources of the chaplain. It's ecumenical. You meet the needs of the child. The chaplain also works with all the faith leaders in the community. So if a child leaves the CAC, they no longer need or want the services of the chaplain helps make a referral in the community. Let's say the child is Catholic. You wouldn't make a referral to any old priest. You make a referral to a priest who's been trained, who's trauma-informed, and knows how to coordinate spiritual care with the medical and mental health team at the CAC. That is the role or potential role of a CAC chaplain. And we know it's important. This was a study from Johns Hopkins saying that maltreated children who maintained a healthy sense of spirituality, it was a significant buffer. It was a meaningful source of resiliency against a high ACE score. Here's a free online spirituality resource you could get into the hands of children tomorrow. So I mentioned Michelle Manson-Thompson and the resources she's been developing that have been published on AVA, APSAC, and our website. She does one every week to build resiliency in youth in this quarantine era. And her fourth one was on spirituality and developing spirituality or utilizing spirituality as a coping mechanism. You can see I was her guest on that column. I don't know what you think of the cartoon of me. But in any event, that's a free resource. I mentioned our Keeping Faith training. Our next scheduled offering was April 27th and 28th in the Twin Cities, but because of the pandemic, we have converted that online, and we still have about 50 spaces before we would cut off registration. So if you know faith leaders you think would be interested in that training, they can do it online, and Bree will post the link where you can access more information. Or if you're in a CAC and you want to grow your knowledge on this topic, consider the idea of a CAC chaplain. You've got an opportunity presented during the pandemic that you wouldn't have had during normal times. Vicarious trauma, hopefully every MDT listening already has a vicarious trauma plan, and if so, you simply need to adjust it for this virtual world that we're living in. If you don't have a vicarious trauma plan, you need to develop it and then adjust it to what we're facing during the pandemic. Here's just some simple things. A buddy system where you got 10 members on your MDT, have everybody pick somebody else and they're their buddy. And they've got certain responsibilities. They're checking in on them weekly. How are you doing? How are you managing your stress? What resources do you need? And somebody's performing the same role for you, exercising the same amount of caution. Most MDTs and CCs, of course, have mental health providers. Can they be a resource, not just to your children, but to your MDT during this pandemic? If you do have a CAC chaplain or a chaplain on your case review team, they could be a resource for addressing the spiritual needs of your MDT members. Could your CAC board do something extra, write a personal note to your CAC employees saying, hey, We know things are tough. You can't come into the office as much as you used to, but we know you're putting in more hours than ever before, and you're managing your own anxieties and the stressors in your family. We just want you to know we're here, we care about you. Let us know what we can do to help you. Little things like that, so that you know you're not alone and the people have your back, can be a source of resiliency. APSAC, which has had such a profound impact on our field for so long now, has been on top of their game during the pandemic, and is one of a number of national organizations that has a running total of new resources for responding to COVID-19. So be checking their website and befriend them on Facebook, and learn the latest that they're coming across as well. Lastly, and I think we will then have about 10 minutes for questions, we included this quote in the article because there is reason to be hopeful. We know at some point the pandemic will end, and we know that even in this crisis, something good may develop. President Kennedy said, in a crisis, be aware of the danger, but recognize the opportunity. This crisis is forcing us to be very creative. And as the crisis ebbs, eventually as the pandemic comes to a close, we need to consider, what did we do during the pandemic that actually was working better than we did before the pandemic? Hey, we were always reluctant to try telemental health, but we really got our act together, and it really seemed to be doing an effective job. We were lowering the amount of time before a child could access a session or therapy. What were we doing that was really expediting, making things better? And if you find one or more of those things, work it into your ongoing plans for the future. Keep good reforms, and then develop a long-term plan saying, God forbid, if there's another pandemic or a similar crisis, what do we do to hit the ground running next time, so that we're not stopping and starting and recalibrating? What do we do from the word go next time? I would say that. And lastly, you're not alone. We're all figuring it out together. Every day I hear new great ideas from frontline professionals. And so reach out to me and APSAC and others, and we'll share what we're hearing from others, and we'll connect you to other professionals. Whatever your need is, you're not alone. We're all in this together. Thanks so much for being a part of this. Janet,
Yes.
any questions you wanted to raise?
I certainly have been collecting questions from the audience, and I would like to give a virtual clap, because that was fabulous. If this were in person, we would lose our question times to applause, but that's something we'll take advantage of on the virtual side. So one question that came in based on this, can you recommend a good screening tool for polyvictimization?
Yes. Our Child First Forensic Interviewing Program, which is taught in 20 states, we've been using a polyvictimization screen for several years. Rita Farrell in our office, you could email her, rita@zeroabuseproject.org, and she can share with you the screening tool that we've developed that's used in a good chunk of the country. And there may be other screening resources that she can share with you as well. So rita@zeroabuseproject.org, and she can send you our screening instrument that's used in a number of CSEs.
Great. Could you suggest some questions that teachers might ask their students virtually to ensure that they're safe without raising any signs to parents about the question?
Well, one thing, you don't necessarily even have to ask the question, but just provide some tools. And so say before your session is over or at the beginning, hey, these are tough times, and sometimes they're really scary times. And I just want you to know, the school counselors are still here for you, and here's how to reach them, and here's other options available to you, and they're still in place even though the school is not open. So just giving them that message might be helpful. But the questions are a really good point. So even if you as a teacher thought you had a really good question, how do you know in a virtual session where mom or dad, the alleged offender, may be in the house? You have to be really careful. So my first thought would be to just say, hey, here's some resources, and we're here for you, and here's how to reach out if you've got any concerns. And then maybe just some generic things. How's everybody doing? How are folks managing the stress levels and the like? And if a child says something that maybe is hinting that things aren't quite right, then figure out a way with the professionals you have access to follow up with that child.
Great. I think you've talked about some of these issues earlier on, but I'm going to pose the question anyway, maybe more of a summary. How has this crisis impacted the manner in which forensic interviews are being conducted? Are you still utilizing the same referral criterion, and are MDT members showing up?
It depends on the CAC you're talking to. So I mentioned Gene Klein and their CAC in Omaha, and they're a really magnificent CAC, a lot of resources there, and they, it sure looks like, in listening to their webinar, they turned on a dime and did a lot of things. But you may have a small rural CAC, and you just don't have as many options. So there's a wide variety of adjustments being made. And so I think the best thing on that, feel free to email me or Rita, or I'm sure APSAC as well. We can talk one-on-one with you about what exactly you're facing and what are your obstacles, and we can brainstorm with you some ideas. And I may be able to connect you with other CACs that have similar demographics to yours, and you can share ideas back and forth.
Okay. And last but not least, in your work and travels, have you noticed any trends or commonalities in the ways that Child Protective Services are handling the pandemic?
Yeah, unfortunately, I'm not traveling anymore.
Okay.
But we are moving to a virtual world, and we are intersecting with a lot of folks. And so, yeah, CPS is making adjustments. My overall sense at the national level, though, is defense attorneys and parents attorneys are way ahead of us. They've been very aggressive in court and very aggressive in publishing articles saying we need to relax standards, you got to stop coming into the homes, it's just too dangerous. And CPS, I think, has been caught a little off guard by that. And so I'm urging folks to push back, and that was one of the purposes of our paper, one of the purposes of this webinar. If you needed to do safety checks before the pandemic, you need to do even more now. I'm not saying, don't endanger yourself, but you got to figure out a way to continue to those safety checks as safe as possible.
Well, Victor, I see Dr. Corwin wants to jump in for a moment.
I just want to thank again Victor, Janet, Mitchell with Zero Abuse Project. And I'm going to open my vest to show the APSAC Colloquium 25th Anniversary T-shirt. The APSAC Colloquium has been rescheduled to New Orleans the end of September. I think Janet may have mentioned that in her opening comments. I want to mention it again. And that this is an extraordinary presentation, Victor. It's recorded. It was actually playing at real time while Victor was talking, although it seemed like 1.5 times. So excellent job to all. Next week, APSAC is offering a web chat on Thursday afternoon at 3 p.m. Eastern Time. Nina Agrawal, who has been attending this web chat, will be one of the speakers, along with Mary Polito, who's the executive director of the New York Society for the Prevention of Child Abuse or Prevention of Cruelty to Children, will be another, talking about taking care of ourselves, the professionals. Brooks Keeshan, who's a quadruple boarded child abuse pediatrician, child psychiatrist, pediatrician at the University of Utah, will be speaking about his development of evidence-based tools for assessing trauma in children by primary healthcare providers. And I didn't mention this, but Nina is at New York Columbian University and Presbyterian Hospital. She's a child abuse pediatrician. So these three people will be discussing how they and others are dealing with the COVID-19 epidemic and from a child protection, childhood trauma perspective. So thank you all.
there's a question in the chat box asking us about any studies that look at child abuse and neglect trends during the pandemic. Dr. Polito, who will be one of the speakers that Dr. Corwin just mentioned, Dr. Polito is the co-author of a study that was just published. So next week's webinar might be a great time to ask that question and hear what her findings were. I want to thank everyone again for joining us. Remind folks to learn more about APSAC at apsac.org. Learn about ZAP at zeroabuseproject.org. And if today's event moves you to join APSAC, we created a discount code just for you today, Zoom Chat 10 at checkout will give you a 10% discount on an APSAC membership that will entitle you to all of the resources that we make available. Thank you, Victor. Thank you, Dave. Thank you, Bree. Thank you to our colleagues at Zero Abuse for the technical support. And hopefully we'll hear and see most of you or all of you again next Thursday.
Thank you.
Thank you all.